This month is Breast Cancer Awareness Month. My name is Jonathan Jones. It's my pleasure to be your host and moderator for this afternoon. I'm excited to have a chance to talk with folks who care about natural health and people who are looking to just find a way to get a better outcome, whatever the issue might be. One of my partners is Dr. Nakuzi, and we've been working together for quite a while. I'm not a medical doctor, to make sure you guys understand that. I'm a researcher. So I'm the director for the Healthcare Support Association of America, but my entire passion and focus has been Engaged Global. I'm one of the legacy affiliates with the company. And I just love what Dr. Prasad has done. And his research has just, in my opinion, blowing the lid off the value and benefits of micronutrients. But I had a conversation with Dr. Nakuzi once, and I asked him, you're a medical doctor, you're a practicing doctor. What is it that doctors want, from their patients? And he said, well, there's three things. He said, we would love for them to be able to clearly tell us what's wrong when they feel a certain thing, or to describe accurately what's happening. Unlike a veterinarian, an animal just can't say where it hurts, what's wrong. The head just droops a little bit. They don't play as much. You can only just observe by behavior. He said, but if our patients can tell us exactly what's going on, we would love that. Second thing, he said, we would love it if the patient would be compliant. I said, what do you mean? He said, well, if we tell them to take, 2 pills 4 times a day or every 6 hours, we'd love for them to do that and do it for as long as we tell them to. He said, but sometimes folks get feeling better and they just stop, or they don't stick with it, and they expect some sort of a miracle to take place. He said, but the last thing we would like, and this is important, he said, we would love it if our patients were emotionally and mentally engaged in their own health and well-being. He says, sometimes they come to us, and this is the doctor telling me this, medical doctor, oncologist. He says, sometimes they come to us and they just expect us to be a miracle worker. They don't want to necessarily be emotionally and mentally engaged in doing something to improve their outcome. Well, that's one of the reasons why this association, this group has come together, is to give you the ability to be emotionally and mentally engaged and getting a better outcome. And what Dr. Prasad has done gives everybody that opportunity to get a better outcome, especially when it comes to dealing with horrible conditions like a breast cancer. And so since this month is all about breast cancer awareness, that's what we're going to focus on today. October, every October, Breast Cancer Awareness Month. You hear about marches taking place all parts of the country. They're raising millions and millions of dollars for breast cancer awareness, for cancer research. And I keep asking the question because I've been hearing about this since I was a kid. And here it is now. I'm every bit of 63. And every year they're raising millions of dollars. So I would expect that by now we'd be moved on to something else. But, hey, let's just talk about where we are and what's going on right now. We are going to be introducing to you Dr. Prasad. Dr. Prasad is our special guest, and he's done a tremendous amount of research in the subject. In fact, the slides that you're going to be seeing today is a great deal of Dr. Prasad's own research. And Dr. Prasad may not even remember when he presented or submitted this research that we turned in the slides. So we'll have a good time hearing what Dr. Prasad has to tell us about this dreaded condition of breast cancer. It was an eye-opener to me to find out that there's a large percentage of men that also get breast cancer. But anyway, our disclaimer: the FDA has not evaluated these statements. Testimonials are purely anecdotal. That means that results are atypical. Simply put, that means that what happens to one person may or may not happen to you. So neither the Healthcare Support Association of America, Engaged Global, Dr. Prasad, Jonathan Jones, or any authorized representatives are making claims that any supplements recommended will treat or cure any disease state. This presentation is for information and educational purposes only, and is not intended to be a substitute for a visit to your doctor. We strongly recommend that you seek the competent medical advice of professionals that you trust. So that being said, you know what? Before we go on to hear from Dr. Prasad as to how normal cells become cancer cells, or whatever he wants to talk about, and I like to leave it that way, that Dr. Prasad feels comfortable to tell us as much or as little as he'd like to share with us, because he's earned that right to be able to do that. But before we do that, there's one testimonial that was shared last week that it was a surprise testimonial. It came up at the end of our discussion. And I'd like to find that for you. I'll tell you what we'll do. I'm going to let Dr. Prasad get started. I'm going to find that one for you, and or maybe share that one with you later. I have another one we'll share with you right now as part of our discussion. And the reason for these testimonials is just to give you some idea that these products do make a big difference in people's lives. And because it makes such a big difference in people's lives, everyone should know about this. This is a woman who chose to be anonymous. She did not want her name to be revealed in any way. So she sent us a letter describing the results she got using, well, she just tells her whole story. So we just had an AI read it. So that's an AI voice that's reading the document, but it is an actual story. Okay, so let me just share that with you, and then we'll get back to the other woman from
one thing.
From
and
last
once
week.
you have cancer, then they become a therapy, different issue.
Right.
From a point of view, you have to know why it happens. Therapeutic is, now you have to know how you can kill cancer cell without killing the normal cell.
Right. Well, I've got another story I want to share with you that I think illustrates that very point. In this case, the first one we heard, the client, the patient, took chemotherapy along with your formula the entire time and went through many rounds of chemo, many rounds of radiation. This story is going to be a little bit different because you'll hear it in her story that she had a real bad reaction initially, and that changed the course of her choices after that, from that point on. So there's no explanation as to why she had a bad reaction. There's nothing said. All we know is her version of it. And I can only say at this point, just for everyone's benefit, she wishes to remain anonymous. So that's why she's not sharing a story. I'm not telling the name. And all we have is AI reading the story. So we just have an AI voice reading the story.
That's
all right.
fine.
So if you can't hear me, if you can't hear the story, then someone stop me, and then I'll try to start it up again. Okay. But it's going to take about 4 minutes or so, again, because AI is doing the reading. And I didn't want her to leave out any of the details either, Dr. Prasad. So I'm going to send this one to you because I think this is one we can gather up the data also and make it into an observational study. Okay.
My experience with breast cancer. A friend of mine was diagnosed with breast cancer shortly before I was scheduled to go in for my annual physical checkup. Due to my very busy schedule, I would have typically delayed my annual exam since I felt well. I went in for the mammogram and had to wait longer than usual to get the results. I had felt what I thought was simply breast tissue or muscular tissue in my breast. It didn't feel like what I imagined a lump in the breast would feel like. So, I mentioned this to the sonographer who would be performing the mammogram. Unfortunately, this did turn out to be a cause for concern for the radiologist. He sat down and explained to me that he suspected I had breast cancer. He recommended a biopsy and a breast MRI, which I did get. To my surprise, the ultrasound and breast MRI confirmed the radiologist's suspicions. Next, I had a biopsy done. So, about 2 weeks later from the date of the mammogram, it was officially confirmed that I had an aggressive type of breast cancer, invasive ductal carcinoma, grade 3, triple positive for estrogen, progesterone, and the HER2 protein. I was stunned since I felt well and had spent thousands of dollars trying to eat healthy, organic foods. Afterward, I was referred to an oncologist and assigned a breast navigator. I had many questions for each one. Their solution to my health crisis was the conventional approach, surgery, 12 to 19 rounds of chemotherapy, followed by radiation. I didn't like any of these options. A family member encouraged me to seek a second opinion. The second oncologist recommended chemo first and then surgery afterward and indicated that the cancer was very aggressive and had already begun to spread. So, I finally consented to take chemo treatments with the hopes of buying time to try a natural approach. Taking chemo was a disaster. I came near to death after receiving the first round of chemo for only about 30 seconds to 1 minute. I couldn't breathe. My lungs were rapidly filling up with fluid and my heart was as if it were going to stop beating. I truly felt as if I was drowning in water, but I was only sitting in a chair while receiving chemotherapy. I tried to get up from the chair to call for help, but I couldn't get up quickly enough. A family member who had accompanied me, fortunately, ran to get the nurse who had administered the chemo. She issued some kind of alert to notify the doctor on duty, and staff came in droves to assist with this crisis. She pumped me with a huge dose of a drug to try to quickly reverse the effects of chemotherapy. Fortunately, I was able to breathe again and the fluid in my lungs seemed to dissipate. For 2 weeks, I was affected by the decision to take chemotherapy. I was in bed for about 2 weeks. I struggled to get up or to walk about and had great pain throughout my body. The pain was excruciating. Nothing I took would stop the pain. I prayed earnestly for help. And, finally, relief did come. A family member gave me water with an electrolyte powder mixed in it. Eventually, after much prayer, I went off to sleep and later woke up feeling somewhat better. I resolved in my heart that I would never, ever take chemo again, even if I had to die. This decision angered the doctors. However, I was determined not to repeat the horrible experience I had with taking chemo. 2 dear friends spoke with a relative of mine about Micro Daily and how it had proven helpful to many individuals with serious illnesses. Since I was determined not to go the conventional route of receiving chemo, I decided that doing something would be better than doing nothing. I began to go on a regimen of 27 EMF capsules each day, 9 in the morning with breakfast, 9 at lunchtime with food, and 9 in the evening with food. Although I refused to continue with the conventional way of treating breast cancer, with surgery, chemo, and radiation, I did want an oncologist to continue to monitor me over the months to advise me on the rate of the spread of aggressive cancer. So, several months later, I went to a new oncologist who decided to get a baseline of how much the cancer had progressed. He recommended that I, at a minimum, go and talk with a surgeon about my diagnosis and have a PET scan performed. During all of this time prior to seeing the surgeon, I took the Micro Daily religiously. I believe that in the oncologist's heart, he was sure the cancer had spread. However, when I got the test results back from the PET scan, there was no evidence of cancer found. The surgeon was shocked. He found it very difficult to believe that the cancer was undetectable. He finally admitted that I had experienced a miracle. Next, I went back to follow up with the oncologist. He stated that these tests, such as the PET scan, are rudimentary and that the cancer must still be in my body. So, I had an MRI done a short time later. Either it would confirm that the cancer is still present or confirm that there was no traceable cancer left. After I had the MRI done, the doctor who read the MRI results put in the report that the previously detectable malignant tumor was no longer present and that there was no longer any evidence of any cancer on the scan. When I returned to the oncologist for the follow-up visit, he told me that somehow, I had experienced a miracle and that God, my God, Jehovah, must have helped me. So, I was free to go and no longer had to stay in jail. He simply recommended following up 6 months later to retest to confirm that the cancer was still untraceable in my body. I'm so thankful to the Creator, Jehovah, to a dear family member who kept searching to find something to help me, and to the 2 dear friends, Jonathan Jones and Bernard Dean, who introduced Micro Daily to me. I'm a living testimony that Micro Daily can really work for individuals diagnosed with breast cancer.
We just kind of want to introduce it there and give you guys an idea of someone. Dr. Prasad went on to make some additional comments afterwards, and we'll hear directly from Dr. Prasad on that in just a moment. But I can tell you personally that story happened. I'm directly involved in that story. Bernard Dean was directly involved in that story. I know the person firsthand. So for some of you who may be wondering, whether or not that was just conjured up or something, I can assure you that it was not. So anyway, that was just to kind of set the stage for our discussion. And mind-numbing, and for some, quite shocking indeed, and I'm sure of that. But I'm going to go ahead and set the stage for, while Dr. Prasad stepped away for a moment, I'm going to go ahead and just line up and tell you who Dr. Prasad is and why we need to pay attention to his comments. This entire discussion, by the way, is being live streamed. It's being live streamed on YouTube. And for those of you who are in our audience on YouTube, thank you for joining us. And feel free to share the link with anyone, invite anyone to come in. You can put it on Facebook if you'd like, if you've got an audience there. If you can put it on any streaming platform that you have to invite folks to hear this discussion. If you'd like to hear it later and share it with anyone later, you can just go to my YouTube channel to get access to it. It's youtube.com/Jonathan Jones. youtube.com/Jonathan Jones. And we'll put that in the chat to make it easy. Just go to the live section, and when you get to the live section, you'll be able to see the latest live stream discussion on breast cancer awareness. But as you can see from this side of the screen, Dr. Prasad was a professor at University of Colorado School of Medicine for some 30 years. He was the director of vitamin and cancer research. He was also the former president of the International Society of Cancer and Nutrition, member of the British Society of Medicine. He was invited to be on the Nobel Peace Prize nominating committee from candidates in medicine. And that, we really could just read that one line, and that should be the end of the discussion right there, because they just don't invite anybody to nominate someone for anything when it comes to, especially when it comes to medicine and this level of science. But he was the world's first radiation biology Ph.D., and his products have been awarded some 7, it's been more like 10 U.S. patents on micronutrients. I asked AI to give me a list of all the patents Dr. Prasad was a part of, and it came back with this list of 20 different patents, and I picked 1 or 2 of them, and it was completely wrong. It was not directly related to Dr. Prasad. So I queried the AI, and I said, wait a minute, this is not Dr. Prasad. What are you talking about? And the AI said, well, it had an ingredient in it, vitamin E succinate, that is listed here, that Dr. Prasad was the one that discovered. So it attributed it to Dr. Prasad. So it had some of Dr. Prasad's research embedded in the patent. So it was giving credit to Dr. Prasad for that. So I tell you, you just got to be careful with this artificial intelligence, because sometimes you wonder just how intelligent it is. But anyway, the next line you can see on there is that Dr. Prasad discovered the anti-cancer potency of vitamin E succinate. Now, that also is kind of a mind number for me, because I didn't know that there was multiple types of vitamin E personally. I've been associated with the nutrition and natural health world for 30 some years, and I had no idea that there was multiple types of vitamin E, or at least I never paid attention to it, put it to you that way. So I feel a little bit ignorant. And but Dr. Prasad determined that one of them, he is the scientist that figured out that one in particular happened to be cytotoxic to cancer cells. That's the vitamin E succinate. So when you get to the part where you're saying to yourself, what makes this micronutrient different from anything else, just remember, this is the man that discovered which one of the components happened to kill cancer cells. Oh, by the way, and it crosses the blood-brain barrier, and that's a big deal. He also discovered that butyric acid, the small fatty acid formed by the fermentation of fibers in the gut, is an anti-cancer agent. So when it comes to a probiotic or a prebiotic, this is the man that figured out something that happens when it comes to the science and the chemistry related to fibers fermenting in the gut in relation to bacteria, pro and pre, that has an anti-cancer. Who do you want formulating your products? That's right. He also is the author of some, this says 32 books, but I think it's more like 35 books now, and he's been published more than nearly 300 times in peer review publications. So Dr. Prasad has begotten more than most of us know. So it's a pleasure, my privilege to introduce Dr. Prasad to our discussion, and happy to get his insights on this subject of breast cancer. So Dr. Prasad, thank you very much, sir, for joining us. once again, as you do with discussions like this.
I'm always very happy to be with you, Jonathan, and my engaged family. I love them all.
Yes,
And
indeed.
yeah, I think when it comes to cancer, there are two issues. One is prevention of the cancer, another is treatment of the cancer. And both are totally different approach, 100% different. And today, what we were discussing in the slides is the question is how to prevent cancer in general, including breast cancer, leukemia, you name it. Because mechanism is very similar, except different tissue are affected. And so, but because these are all mutation, and mutation by chance can happen in a blood cell, can happen in breast cell, can happen in prostate cancer. Anything, it is just a chance mutation. And like you mentioned, that we have in body, we have oncogene present in every place, so in every cell, but by chance, breast cell get activated, then it becomes breast cell, become normal cell, become cancerous. But also, there are tumor suppressor genes that is present in all tissue in our body, and that keeps the tumor oncogene downregulated. And so, but when mutation occurs,
You said down-regulated,
they
so they,
downregulated,
I
they
see. Okay,
become
right.
decreased. So now cell become cancerous. And third is that normal cell, normally in your blood, in your body, divide, differentiate, and they die. This is the normal pattern every time it happens. This is the way new cells are formed. And when they form new cells, they differentiate and they die. This is the normal pattern. And so when that differentiation gene that causes differentiation of the cell, normal cell, differentiated and died, but now they cannot differentiate it because you have mutation in differentiation gene, so they cannot differentiate, therefore they cannot die, and therefore they become cancerous cell. So there are three different mechanisms.
And that's what the differentiation is, the death.
Yeah.
I'm sorry, go ahead.
And then you have a tumor, for example, you have some agents, we refer to tumor initiating agent. But suppose oncogene get activated, or some agents like benzopyrin X radiation, smoking, aflatoxin, EMF radiation, they're all initiating agents. But tumor can be initiated, but they remain dormant for a long time until tumor promoting cells comes out like estrogen, testosterone. In case of women, estrogen is a tumor promoting agent, exception of exposure in case of melanoma, formol ester, fatty food, these are all tumor promoter. But if the dose of initiating agent high enough, then they themselves can cause cancer. They don't have to
Wow.
wait till tumor initiating agent. But if the exposure of these low dose, that's the time they need a tumor promoting agent.
Wow, that sounds like a recipe for disaster because if based on what you're saying, Dr. Prasad, these are
Yeah,
components that are already in our body all the time. So,
yeah. You know, tumor initiating and increased oxidative stress can induce mutation in genes, normal cells which continue to divide, differentiate, and die in a normal pattern. If oxidative damage is not repaired, chronic inflammation sets in motion. So the first thing that occurs is increased oxidative stress. And here is the activation of the oncogene. Increased oxidative express chronic inhibits the development of cancer cell. Why? Because tumor-inducing agent at high doses can eventually cause cancer, and because of mutation in oncogene. Tumor suppressor gene or gene responsible for differentiating normal cell to become cancerous. So these are the three targets that happens through by chance. It can happen in any tissue. It is just a random events that you can't predict it. But sometimes, yeah, proposed differentiating hypothesis we proposed while we were working with the in my in a neuroblastoma cell, which was the childhood tumor, very malignant tumor. And when you elevate cyclic AMP, they become normal cell. So then I said, well, maybe you can you can induce differentiation genes because they were not differentiating it. And that's the reason I proposed differentiating idea.
That got you pretty famous, didn't it?
Yeah, yeah, and this is amazing, and that's made me internationally famous because that is the first time it was demonstrated that cancer cell can become normal cell by manipulating internal environment. And cyclic AMP is normally present in the body, but it is low level. If you elevate high level, the cancer cell, cancer cell become a normal cell.
That's interesting. So Dr. Prasad, this we hear a lot about this oncogene and tumor suppressor gene, and nowadays a lot of that is in the scientists are talking about that a lot right now because cancer is on the rise.
Yes.
There's so much more of it.
Because many factors are there, why it is rising: environmental factor, dietary factor, lifestyle-related factor, exposure to many carcinogens. And not only that, but also when you eat food during digestions, depending upon what kind of food you eat, if you are a meat eater, you will feel during digestions more carcinogen. If you are vegetarian, you will form less. How do you reduce that? If you take an antioxidant before eating that kind of food, no carcinogen will be formed. So if you take 2 or 3 capsules of micronutrient before taking meat, there is no formation. Also, for example, in the morning, we always love to eat bacon, including myself, my wife. We love to bacon.
Yeah.
Crispy bacon we like.
Yep.
But, bacon is loaded with nitrite.
Yeah.
As a preservative, because if you don't add nitrite, you might die of infection. So the nitrite, and what nitrite does, it goes in your stomach. In acid pH, there is already one compound present called amine, and they form nitrosamine, which is a very powerful human carcinogen, initiating agent, not promoting. It is initiating agent. And so again, some of these minor things people can do that can prevent the cancer.
But Dr. Prasad, hold on a second now. So you're saying that I have in my body tumor promoting agents.
Yeah.
And I'm eating or being exposed to tumor initiating agents. So are you saying then that antioxidants can actually block those two from coming together and potentially prevent me from
They don't form nitrosamine. They prevent the formation of nitrosamine. They cannot combine together.
So I need to have high doses of antioxidants in my body. So backing up then to that AI testimonial, how is it that high doses of antioxidant? Because she said she was taking 9 packs.
Yeah, that is the recommendation.
3 times a day.
But it is, again, that is treatment is totally different issue. So
okay.
For treatment. So now if you talk treatment, that is a...
Well, you want to talk about treatment next week, then that'll be fine. We can do that on our next discussion, in part 2 of our discussion.
Yeah, but at least for that, to explain that phenomena that she just presented, is that the cancer cell require 2 micronutrients to survival. No matter what kind of cancer it is, no matter what stage it is, no matter where it is, doesn't make difference. They all require the glucose and glutamine. And what I discovered, it was there, but I found out that high-dose antioxidant we were demonstrating for a long time, it kills cancer cell, but not normal cell. High-dose antioxidant enhances the effect of radiation and chemotherapy on cancer cell, while protecting normal cell. But we
Okay.
didn't know how it does it, so nobody believed it. But later on, we found out it does it because high dose antioxidant block the uptake of glucose and glutamine, and cancer cell have no choice than die.
That sounds pretty elementary and fairly straightforward. And that one example really speaks to that then, Dr. Prasad,
I will
because
call you a little later, Malu.
all she did was take,
Yeah,
in her words,
just
she claimed that all she did was take
yeah, and cancer
high
cell.
dose.
And in this case, suppose somebody has become a cancer resistance,
Mm-hmm.
not cancer, treatment resistance like
Treatment
chemo.
resistant.
It makes no difference, but still they're cancer cell, and they will die if you deprive them with glucose and glutamine. And high doses that we recommended that she was taking will do that. And
That's incredible.
that's so good.
That's
It's so
incredible.
simple. Jonathan, is so simple mechanism that I don't know. Because see, until it is done in a clinical study, FDA approval, nobody pays attention to.
That's right.
But
That's
I'm
right.
glad at least we are making a difference in life of a few people. That makes me happy.
That's right. Yeah, you're making a difference in the life of a few people. I think I have the story that I want to share at the beginning. So why don't we inject that story right now and see if we can't get your comments also on maybe how this particular breast cancer case could have benefited the way that she's describing it. So let's see if I've got the right, if I'm cued to the right place here. Okay.
All right, Sharray, you are next, and we might get Bernetta in, but go ahead, Sharray. We've been looking forward to this one. Go ahead.
Okay, great. How you doing? My name is Sharray Faust. I was diagnosed with HER2 triple negative breast cancer of September of last year. And because breast cancer run in my family was not going for no natural stuff, even though I kept on insisting. But at any rate, I went through the program, you know, what they set up with the chemo and everything. And I would start praying and praying. And because even though this is supposed to help me, I just couldn't understand why I was feeling so sick all the time. Well, at any rate, I was introduced to the product through Michelle and Bernard, which I love them dearly. And I love Dr. Prasad because of the fact that once I got introduced to these products, I signed up. Basically, I was going to Michelle for another treatment, and she kept on insisting about the Micro Daily. But I've tried so many herbs and so many other things. I was like, let me just do what my family, you know, want me to do. This is the best route. But when Bernard seen me, he said to her, did you tell Sharray about the Micro Daily? And she said, I tried to, honey, but she's always leaving. But at any rate, I went ahead. I said, well, okay, let me try. But Bernard said, you know, Sharray, they have people that have had cancer that it has worked for. He said, you could listen in on Sunday and it's alive. You have any questions, blah, blah, blah. So I was like, okay, well, that's the least I could do. So on Sunday, I listened to the meeting and I was hearing all these wonderful things. So I said, okay, let me just get it. It's what, you know, it's 90 days. If it don't work, I get my money back. So I did. I started, like I said, in January, still going through my treatments. But in my treatments, I start noticing them telling me, oh, Miss Faust, you're doing so well. Your numbers look so good. Whatever you're doing, keep doing it. I was like, okay. So when I started realizing I had energy so that I could bring my daughter back and forth to school, I was like, well, maybe it is something in this stuff, but I'm gonna just keep on trying it. So when I went to do my other treatment, because I would go every week, the oncologist said, my numbers look so well that they are thinking about reducing my treatments. When she said that, I was so happy because that's what I wanted my prayer to be answered. I didn't want to have to do 24 rounds of this stuff. But she said we're going to talk about it with the other doctors and we'll get back with you. When I went back the next week, she told me that they had agreed that all I needed was 4 treatments. That's what they told me that I would need. I was like, okay, that sounds good. I was just like so thankful for that they reduced it. So I did that treatment, and when the next week came, another oncologist on the same team recommended that I should I didn't have to do the chemo in that form and maybe I could go to the pill. Well, while they was debating about what to do with me, I went and got another second opinion because, that's what you got to do. But anyway, I went and got the second opinion from another hospital totally from the one that I was going to. And this particular doctor says, after they did the PET scan, Ms. Faust, we don't see any cancer. But since you were tested with cancer cells on your lymph nodes, we are suggesting is just to do the removal of the lymph nodes. I asked how many. She said that they really didn't know. She said it's going to probably be between 8 to 10 lymph nodes that they would have to remove. So I said, okay, let's go for it. So I had the surgery in May, the end of May, when they went to, and I'll continue to take the products. I was able to talk to Dr. Prasad. He told me exactly what to do before the surgery, so I didn't take him the day prior to the surgery. When I went to get the surgery, you guys, I'm thinking in my brain, they done took all my lymph nodes. I'm going to get sicker. I'm going to do all this stuff. Do you know the doctor says, Ms. Faust, I'm so amazed because we only removed 3 lymph nodes, but only one of them had the cancer. Right when she said that, I knew that this was a blessing because I was doing the therapeutic dose. I feel to believe that if I would have continued to do the therapeutic dose and not let the doctors and my family pressure me, I would have been wonderful. But at any rate, I'm not doing any chemo. I'm not doing any radiation. In fact, they are so surprised of how well I'm doing. I'm scheduled to do a mammogram on October the 1st. But I want to thank Dr. Prasad. I thank God for using your brains to help us. And I thank Bernard and Michelle so dearly. And I thank you guys for listening to my story.
So Dr. Prasad, that's pretty remarkable to hear that. That's yet another example, and that one speaks to what we said earlier about a person being involved and getting a better outcome. So she took the conventional, but took your formula along with it and improved the results according to the doctor.
See, it is so simple, but but it can't be widely used until it is get FDA approval. And as you know, I have a patented formula of high-dose antioxidant, but we're having a trouble on getting funded. So, but anyway, as long as some people I can help, that's good enough for me.
Yep. Well, it's exciting to hear it. And these kinds of results speak to your genius and your brilliance.
No, I mean, if you tell oncologists, you say, no, this is all fake, nobody will believe it. All the 2 examples or 3 examples you presented, nobody will believe it.
No, they have
except person who went through and what we believe totally.
That's right. Well, by law, we're allowed to tell them the science. And
Yeah.
just the
I
disclaimer.
mean, again, science is there. It is not that I arbitrarily am saying, okay, try this one. No. Why it is working, it is there. That's
right.
good science. Not many cases you know why anything is working. sometimes you get a good result, but we don't know why it is doing it. But in this case, know exactly what it is doing it.
That's quite incredible. Well, these are the different. Apparently, this is the different types of ductal carcinoma that can take place.
Yes, yes.
If it's ductal and the advanced cases over there is really, really bad, invasive ductal carcinoma. But what she said was similar to what we heard in the very first story there with the HER2 situation.
One amazing was the triple negative breast cancer, which is inherited from the parent, and she had a family history of that. That is most difficult to treat.
Mm-hmm.
But she got a very good results.
She got excellent results with it. A question just came up, Dr. Prasad, and I think it was Corleen. Does it matter what kind of cancer, what kind of breast cancer would it make a difference?
No.
With regard to taking the high dose of antioxidant, does it work on certain kinds, but doesn't work as good on others?
No. As long as it is cancer cell, makes no difference.
Mm-hmm.
Whether it's a breast cancer, whether it's a leukemia, whether it is prostate, any, makes no difference because all of them require glucose and glutamine for survival. And high antioxidants blocks them.
It blocks the uptake of glucose and glutamine.
That's right. So cancer cells have no choice than to die.
Dr. Prasad, you said that in your science here, you said that it could take 10 years for leukemia to manifest and 15 or more years for solid.
Well, are you saying figure varies from, it varies from one tumor to another. Nobody knows why, but many factors, during the course, once you get exposed to carcinogenic agent, X-ray, chemical carcinogen, then it depends upon the cell how, for example, leukemia cells are rapidly dividing. Maybe they take earlier, whereas the other solid tumor, they don't. Nobody knows for sure why, but it does make difference. But this is the time to intervene. In other words, either in leukemia, you intervene, prevention strategy is totally different because you don't know when cell becomes leukemic.
That's right.
So, and if you don't know, but if you know you are exposed to very lot of daily environment, poor diet, poor lifestyle, and so on, then at least you can take core 4 for prevention, not for treatment, but prevention.
For prevention. So Dr. Prasad, we're talking about now bacon that I had 10 years ago could be causing a problem for me if I don't do something now.
But what did you say?
It's a certain food that I ate 10 years ago. I need to do something now to slow the chances of it leading to something becoming carcinogenic. I have time not to intervene, basically.
Yeah, so I think if you are exposed to something, you have a time to do core 4, and so it will reduce the risk of developing cancer. I mean, there is so much data that oxidative stress and inflammation can cause all those mutations. That it is natural that it will cause prevention, and there is a lot of animal data available that shows this is the case.
No, that's quite incredible, and it makes perfect sense. And what you told us about diet is extremely important. So we see that right in front of us. You told us a little bit.
Yeah, but try to do as best as you can. Good diet, good lifestyle, exercise, and meditation, all these kind of things.
Yeah. You told us a lot about how these nitrosamine can impact, but antioxidants will make the difference.
Yeah, not only in the stomach, the nitrosamine, but carcinogen substance also form in the intestine during digestion. If you are a meat eater, and it was done very nicely by a Canadian study in human. This was demonstrated human. They measured the fecal and they found a lot of mutagens. But when they treated them with vitamin C and vitamin E, same diet, meat diet, there was no carcinogen.
Wow.
It was a human study, demonstrated conclusively.
That's pretty amazing, Dr. Prasad. So we have your recommendation right here as to what a
This
person
is for
should do
prevention.
for prevention.
Yes.
Okay, okay,
Because this is Micro Daily would reduce oxidative stress because it's prevention, because oxidative stress involved in activating or deactivating genes there. And so that will help in prevention. So this is not recommended for treatment. It is
okay,
one prevention.
okay. So this level here, the Dr. Prasad puts
So you
together
should change the slide like proposed recommendation for prevention.
Yes, for prevention. Okay, all right. I'm going to modify that slide. And in 2 weeks' time, we're going to talk about the other half of the discussion as to what steps a person can do as far as high doses are concerned when it comes to treatment. So you heard it, folks. This is Dr. Prasad's statement. And again, we repeat that we strongly recommend that you seek the competent medical advice of professionals that you trust. But this is for education and information purposes only. So keep that in mind. This is Dr. Prasad's formula here. This is the most advanced formula, Micro Daily EMF. And it's the one that many of these folks have been referring to. It not only does it have the original base formula of Micro Daily, it's also got 4 additional ingredients to help the body deal with 5G radiation that we're all being bathed with every day. Get it on subscription and you get the discount price. He recommends the Probiotic Daily, and combine those two together. That way you take your gut away from dysbiosis and more toward balancing your entire microbiome. And Dr. Prasad chose heat-resistant and acid-resistant strains of bacteria. So this, in even smaller quantities, has a better chance of making it where it needs to go to get the greatest results. Outstanding probiotics, the best one I've ever put in my body personally. And then this is Dr. Prasad's omega-3. He put a much higher balance of omega-3 versus omega-6 because Dr. Prasad says we get plenty of omega-6s in our diet. So that's what's inflammatory. So he made sure to sway it toward what we actually need. And EPA and DHA, those are extremely important. My favorite component here is the borage oil, because borage oil has been known. In fact, it was Dr. Julian Whitaker that wrote an article decades ago about borage oil being beneficial for diabetic neuropathy. So Dr. Prasad put it in here. So that's has been added into his formula. So it's an outstanding one. And this is the only one Dr. Prasad recommends that if you have active cancer cells, do not take the collagen. Right? So just save this for later. This is part of the core 4. And if you know that you've got active cancer cells, don't take this one until after the doctor says that you're free. Then, but for the rest of us, this is great for your skin, and great for the tissue.
The collagen peptide, one thing I want to mention here, collagen peptide, it has an inhibitor of collagenase. That was the main reason why I added it, amla extract and white tea extract. But later on, we found out they also have an inhibitor, a small amount, but inhibitor of DPP4 enzyme, which destroys GLP-1. And that's why in many cases, since it has an inhibitor, if you combine collagen peptides, and if somebody has a risk of diabetes, that improves glucose metabolism, secretions of insulin, because one of the major functions of GLP-1 is improve the secretion of this from the pancreas to the blood. And that is mediated by this enzyme. But if enzyme is very high, that secretion is blocked. So the collagen peptide, at the time when I added, I didn't have any idea. But later on, I found out it has a small amount of inhibitor of DPP4, which prevents the secretion of insulin from the pancreas to the blood, and therefore it causes problem. Wow. So it improves glucose metabolism. And then you will see that now we have a new product, GLP-1, where we have a specific inhibitor of GLP-1, DPP4 inhibitor by 87%.
Oh, wow.
This is about 30%. And so new modified GLP boost product, we will see will have an inhibitor of DP4 that no other GLP product that is being sold in the marketplace has that.
That's beautiful. That's beautiful. So
And they can be easily patented because nobody has it.
It stands alone on its own. And I hope that folks are listening carefully. So if you are diabetic or in the throes of metabolic syndrome, you need to be getting the collagen. You need to make sure that you're on the GLP-1 boost as well. And by the way, Dr. Prasad, turns out Sharray Faust, that last story that we just shared, she told about her breast cancer. She is on the meeting now, and she posted a comment that she is still good. And she said the doctor came back to ask, can she take 2 more images? I agree, and still nothing on the images showed cancer. She says everything is still good. So right now, she's happy, excited that she's got good results by adding your formula to her regimen. So that's great to hear. But anyway, here's the CBD boost, outstanding, the brain boost. All these formulas are done by Dr. Prasad, folks. So we don't have time to go through them all, but just to let you know that they exist, and you can simply speak to the person who invited you to this discussion. The core 4 that you want, really, folks, is the GLP-1 core 4. It's about $100 more than this one. It adds the GLP-1 to it. And the GLP-1 boost is, instead of getting injections with Ozempic or Mounjaro, you can just take Dr. Prasad's formula, and your own body will make its own GLP-1 and GIP. So instead of having a semaglutide that pretends to be that or substitute for it, you can make your own. So the GLP-1 boost core 4 is the best way to go. And but again, you can just talk to the person who invited you to this discussion, and they will help you to put together the right combination of products and the right bundle that will work for you. But before we end our discussion, we just like to remind you, and Dr. Prasad encourages us to, please don't expect a pill, potion, or lotion to do for you what you could do for yourself. Get moving. Change your relationship with your couch. Get out there and walk. Nowadays, instead of it being thinking about 10,000 steps, scientists and researchers have found that 7,000 steps is ideal. That's about 3.5 miles a day, if you can do it. And if you can't do it, do more than you're doing now. Instead of finding the closest parking spot next to Walmart or Costco or Sam's or wherever you shop, park as far away as you can. Take the stairs when you can. Get those steps in, folks. It is the best thing you could possibly do for yourself. And that's in line with both Dr. Prasad's recommendation and Dr. Nakuzi's recommendation. So, and one special announcement for next week, Bernard Dean is going to be hosting our show next week, and he's going to be featuring David Nemelka. So you're going to be hearing all about the incredible Engage story next week, and what a huge opportunity that everyone has. So there may be some here now that are trying to figure out what they're going to do. Some folks got doged. Some people are struggling with increasing costs of living. Well, you'll get a chance next week to hear about what options there are with respect to this amazing company that Dr. Prasad is the Chief Science Officer for. So, Dr. Prasad, we can't thank you enough, sir, for your being willing to step in here and provide us with just snippets of your brilliance and your genius, and to expose us to so many people that are benefiting from your amazing story. So thank you for joining us.
Yeah, always pleasure, very much, to be with you and Engage family, and I love them all.
Well, that's a beautiful thing. And I think everyone expresses that they love you as well, Dr. Prasad. So if anyone wants to unmute now, feel free to do so. But join us next week. Share the recording with others. And my team, we're meeting at 6:15. So thank you again, Dr. Prasad. You guys have a good night. Everyone, thank you.
Thank you so much. Thank you.
Bye-bye.
Thank you, Dr. Prasad.
Thank you, Dr. Prasad.
Thank you.